Front, anybody can. My voice is okay or fan voice is more? Okay, so bit of we are not able to provide you AC environment here, but don't mind. Okay, so I'll take you very quick walk through. Majority of the time where we are in any hospital setup, we have been trained to be like a, olden times there used to be horse which will only look in front, and they'll tie something to the horse and they'll be looking only in front. So our education system is as such that we are not allowed to look here and there and see the other supportive part. So I'll just show you one research based one component. If I add these three as one of the component of body, if I show this broad diagram, where we stand for healthcare is only here between the human body and bit of psychology. So this part we call it as healthcare system. We all call it as healthcare system, but I call it as sick care system. Now you think of the conventional medical science where it is focusing on, see all 10 of you are here. Imagine a big hospital. Usual style of working is primary care center, secondary care center, tertiary care center. Primary like ours, primary care, very basic doctor will be available, physiotherapy, basic physiotherapy will be available. Secondary little higher, MD, MBS, all those little higher specialties. Tertiary care like Sakra and all other hospitals where tertiary care services are provided. For example, in an Indian case scenario, Sakra is supposed to be the one of the best rehabilitation center because they pump a lot of money, is it not? But affordability is beyond the reach of common man, is it not? So when I call this as a sick care system, I cannot call this as a healthcare system. Do you agree? Because I am not touching upon the mind part at all. I am not touching upon the spirit part at all. Belief part I am not treating. Say, for example, somebody is having epilepsy, and they say, based on their religious belief, somebody will say it is a curse of a god, Allah ne kiya hai, nam karma ide, savar karma. So that will get stuck on their back of the mind. It will bring into the compliance issues where they'll not do it by, if you tell them to do, okay, do a range of movement, otherwise you are getting into disease atrophy, they'll not do it because they feel that, okay, nam karmadal bandide now aste hange irutte sir. Will go into a disease atrophy. Patient compliance reduces. So that part of the mind also matters, where we fail to address and understand. We fail. Our system is as such that you have been allotted at one point of time some 30 patients. 30 patients. What maximum assessment you can do? Only physical assessment you can do. You hardly touch upon the spirit, hardly touch upon the financial aspect of the patient. You'll ask, what you are doing. Occupation also we do not ask. Hardly touch upon mind part. So true healthcare system is which incorporates what is your family. I'll give an example. Somebody, a Muslim lady wearing burqa all the time, having vitamin D deficiency. See the difference. Family also matters. The belief system matters. Community at large. Now, India recently have become tuberculosis, syphilis free because of the community work. A largest scale of COVID vaccination done because of the community orientation. So, workplace. Sitting is a new form of disease. Sitting is equal to 20 cigarettes per day because our normal lifestyle. If you see my tummy, Indian person having apple shaped tummy and American having apple shaped tummy, Indian will get fast diabetes compared to American because of the gene called as FF. They say, for example, there is one FF gene in the body which will make the Asian body more susceptible for diabetes than anybody else. Yes, it is like a polar bear which it will eat one time, it will store the fat for long number of times. Some gene related to that. Now coming to the hard-hitting case scenario in the present situation, if you see NCD, non-communicable diseases, WHO statistics of NCD is 41 million deaths every year. 41 million deaths every year. Majority of the diseases are not related to any infection, and majority of the deaths between 40 to 60 early deaths are because of this NCD, non-communicable diseases. It is hardly addressed at all by any specialist. We are going in the direction of producing more number of doctors. Present scenario, somebody was joking in a Instagram scenario saying that now recent times, after another few times, there will be a app which will come. App will say, okay, this so and so Shashikant doctor is there on this app, you book that fellow. So the doctor will come within 10 minutes, like Zomato, within 10 minutes at the 500 rupees the doctor will come. So that kind of scenario can come, because when you see any doctors or physiotherapists applying for a job, if you see for a smallest of job, there will be some 17,000, 20,000, 30,000 applications. It means somewhere there is some problem with the system. So which government may not be able to understand. Government thinks, okay, we'll make more AIMS, more hospitals, more doctors will produce, and things will be all right. It is not. Urban case scenario, urban is a highly concentrated and highly competitive, and rural is no space. So rural is more occupied by Aish, I'll tell you that. So in Indian case scenario, 68% NCDs. So four majority of the causes of death. First one is a cardiac, second one is cancer, third one is COPD, fourth one is diabetes. Worldwide also same scenario. Only 4 groups of disease causing majority of the death. That to 70 to 80% world ratio. 68 is an Indian NCD, non-communicable disease ratio. So for this, all the government planning, Panchavarshik Yojana, 10 years program, everything they'll do properly. Planning will be very best in India, but implementation wise it will fail. Like Mohalla clinics of Delhi, it will be some other activities will be happening there, but not, So the gap. So this is actually permanent marker. I may not use it later. So coming to our topic, conventional medical science, if I say, and complementary medical science. So usually all of our physiotherapy doctors are exposed to the conventional medical science, all the major hospitals, primary, secondary, tertiary care hospitals. Beyond this, we do not have any other idea of other sides of the therapies existing. So those are all Ayush, Ayurveda, Yoga, Unani, Siddha, Homeopathy. So in Indian case scenario, healthcare sector is very unusually complicated, where there are around 13.5 lakhs of allopathy doctors, so-called modern medical doctors. There are 7.5 lakhs of Ayush doctors, Ayurveda, Yoga, Unani, Siddha, Homeopathy, all the small clinics, wherever you see, these are all majority of the Ayush doctors. Problem is, majority of the Ayush doctors are practicing conventional medical science. Majority of the Ayurveda doctors are practicing, so they do not know anything about physiotherapy. They might write physiotherapy, they might arrange the machine, because machine costs some few things, and they might hire some BPT. They'll say, okay, do some treatment. So treatment, the physiotherapist has become just a tool for doing the treatment and getting paid. So we are losing the individuality as a student or as a teacher. So for us to have a competitive edge, I must know what is happening around me. So 75% of Indian healthcare scenario is privatized. 42% of urban population, 49% of rural population goes to government hospitals for treatment only when they feel they don't have money in their pocket. How many of us usually refer, go to Boring Hospital, go to Victoria Hospital, we refer patients. Patient will not be able to go because they know the style of work and things. Coming back, there is a huge gap between one I said NCD, non-communicable disease. Much before disease starts, doctor can come only when the disease starts, that too for a temporary phase of a diagnosis and writing the treatment. After that, what? Doctor has diagnosed the treatment. Okay, you are having muscular dystrophy, whatever you have diagnosed. You've done genetic testing, muscle biopsy. You have done. Your genetic counselor has come and counseled, and everything. Everything is finished. Every all aspect of creatinine kinase is very high. All those things are fine. But after that, what they'll do? Sir, ಏನಿಲ್ಲ ಅದು ಮೆಡಿಸಿನ್ ಬರೆದು ಕೊಡ್ತೀನಿ. Do aggressive physiotherapy. Aste sir, carry on. Correct. What is left in that particular patient and the doctor is nothing actually. Patient loses hope, doctor don't have much things to offer, and all the burden is on the shoulders of, usually in a conventional medical practice, is on the shoulders of physiotherapy doctors. So here we introduce that aspect of conventional medical science where we want Ayush doctors to practice their own individual field what they studied with, for a livelihood, for for a pet puja, definitely you can practice conventional medical science because hook or crook they will manage. So majority of the cases, small clinics, what they'll do is they'll take allopathy doctor's certificate, they pay him some monthly money. Yeah, as you seen pharmacy people, pharmacy person will give pharmacy certificate and pharmacy will run in the name of the pharmacist, but pharmacist will not be there, he'll be getting paid. So similarly there are things run. Once, if you consider yourself as physiotherapy doctors or something to do for physiotherapy team, we need to understand all these background things. And integration is the best tool. Integrative medicine, it's very new field. In India, what is happening is, India is a country of claims. There used to be one person who treats back pain with hitting the person with the chair in Raichur somewhere. So some Baba used to be there. So my father was there as a part of policeman to catch him, grab him. But when he went there and saw, there was a 600 people waiting in a queue with 500 rupees note, and he just takes the raw iron chair and he'll hit the person's back at a particular way. So those kind of magic treatments exist. You can search and see that. So he is still there or not, I'm not sure. But for us to have a competitive edge, for us to have a definitive edge on professional edge, we need to know these aspects. So super specialty is increasing, non-communicable diseases are increasing. For example, Zomato, Swiggy and all, anything, just to at a push of a button you get a freshly supplied things. So sedentary lifestyle is increasing. India is number 2 in obesity, is it not? USA is number 1. China was number 2 before. Now India become number 2 in childhood obesity. So physical activity is important. Nobody knows. We Indians usually take health as granted. You are aware of it, no? When you teach anything to physiotherapists, patients, they'll be reluctant to do. So ಅಷ್ಟೇ ಮಾಡೋದಾ ಸರ್, ಅಷ್ಟೇನಾ ರೇಂಜ್ ಆಫ್ ಮೂಮೆಂಟ್ ಇಷ್ಟೇ ಮಾಡೋದಾ ಸಾಕು, 10 days ಸಾಕು ಸರ್ ನಮಗೆ. ಸೊ repetitiveness, neuromuscular facilitation usually will not be able to teach. So now coming back to your point is, if a physiotherapist can be a good counselor, if a physiotherapist doctor can be a good healer, if a physiotherapy doctor can be a good person to teach breathing technique, yogic breathing techniques, if a physiotherapist is aware of some certain Ayurveda tricks, he can incorporate, he can make the changes, maybe by himself or maybe in association of the team. If you have team, well and good. If you don't have team, you can be the person who can incorporate those things. For you to incorporate, you need to know. Cupping therapy. Usually do you try to incorporate that? Usually we do not. We know single needle therapy. So I'll just draw some small comparison between allopathy, Ayurveda, and certain aspects. ಅದಕ್ಕೆ ಸ್ಪಿರಿಟ್ ಇದೆ, ಅದು ಹೋಗಲ್ಲ. Somebody given me permanent marker, so I cannot wipe it. Spirit ಬೇಕು, spirit. You have to dip in spirit, it will not go. The hand sanitizer. Hand sanitizer. Okay. Is it boring or interesting? So I went to China for learning acupuncture for 1 year, because WHO standard says when you compare Indian Ayurveda and Chinese traditional Chinese medicine, in 1956, 56, 59, they have done, when Mao was there used to be a decline of acupuncture, traditional Chinese medicine and all. So later what happened, they made acupuncture and traditional Chinese medicine so much important that every allopathy hospital must and should have the small unit of traditional Chinese medical system, and then only the hospital will get approval. So that was the theme. Because of that, when you compare all the WHO, when you go to the WHO.in website, you go for a traditional medical systems, world's traditional medical system. There are medical systems like Indian Ayurveda, traditional Chinese medicine, European traditional medicine, American traditional medicine. I usually use a concept of intuition and intelligence. If I use just a PowerPoint, the flow will be lost for me. I can use it, but it will be easy to grasp. Okay. If I say marma, trigger point therapy, meridians, there is a similarity. Do you agree? So in Ayurveda they say maryate anena iti marma. So the points where you hit hard can cause damage, either death, or if you use softly it can cause healing, marma. So this can be allopathy side, this can be a nerve plexus of nerves, where some vital points like face is a one point where there is one particular marma. So trigger point, if I trigger certain group of muscles, if I say this is a trapezius and I'll press certain part of the trapezius in a particular way, maximum bulk of the trapezius muscles, if I press, it will activate my stretch reflex and Golgi tendon apparatus. Stretch reflex, Golgi tendon apparatus, and it will give a unusual signal to the brain. From the brain spinal cord, it will give afferent and efferent connections, and there will be some change. Either I'll respond to it, or brain responds by sending certain chemicals, endorphins, enkephalins, Levy's P factor and other things, where it will feel healed. Similarly, Chinese people believe that there is an electromagnetic system, prana vayu, or aura, or subtle bioelectrical energy, which is running in our body as a channels. So Ayurveda believes as a srotas. Ayurveda people believe it as a srotas. Prana vaha srotas. Prana means vital energy, vaha means going, srotas are the channels. So Ayurveda believes that there are channels for each organ of the body. Lung there is a channel, spleen there is a channel, for bone there is some channel in terms of nerves. So I can correlate these points if I see from a third point of view, which I am neither a traditional Chinese medical doctor, nor a physiotherapist, nor a Ayurveda doctor. If I see from the bird's eye view, this can be a combination of trigger point. This can be a combination of quick nerve reflexes, Golgi tendon apparatus signaling, or it can be simply nerve plexus stimulation. So if you are practicing trigger point therapy with a single large needle, acupuncture needle, needling you do, you go deep and it will stimulate your trigger point and it will heal. Either you Chinese people will do a stimulation using laser, latest one. Previous one is a Moxie, which I'll show you if it is time. And now presently we use this combination. So if we have a competitive edge, we should learn these things. No need of to go very detailed. For example, I'll show one marma kind of this part. We call it as anatomical snuff box. So there is a marma called as Hagu, large intestine 4. I do not know how the large intestine 4 connects and all, but I know that by pressing that point, and I can demonstrate two because I am very good at these 2 points. Second one is ST36, stomach 36. These 2 points I'll show, where you tell me in your language of study that what is this, what could have happened. Is it a pain reflex? Is it a trigger point reflex, or is it what? Anybody want to volunteer can come. Trigger point. So anatomical snuff box is this. I join first web space, there is a fold here. In this fold I'll go a little bit further, just little above anatomical snuff box and little away from it, there is a point. What do you feel? Painful? Too much pain? Not much pain. You have good do good exercise. Cooking you do. Your lumbricals are strong. But can you feel the pain? You are tolerating the pain. Because who is sensitive for pain? You are sensitive for pain? Come. Sit there. I'll show the ST36 is here. Yeah, what do you feel? Can you feel pain? Maybe your reticular pathway in the brain is so strong, it's analyzed that you do not want to feel the pain. Are you into exercise anything? Sensitive to pain, come. Just see. So our lumbrical muscles are a little bit weak. You can keep it loose, keep it loose. See this. This point I use for a headache relief. Any difference? Pain? Pain. Suddenly. Just to demonstrate. Yes. This I am very good at it. So if you say your brain is forgetting if there is a back muscle spasm, neck muscle spasm, brain is forgetting that pain for certain time. Brain's small C fibers and superficial nerve fibers are focusing on this pain. Brain is shifting its awareness on this pain. That pain is forgotten.
Okay. So that's a shift, is it?
Huh? That can be a shift. Take it, sir. Peroneal nerve.
Yeah. Straighten.
You're holding tight. Now?
No.
Your peroneal nerves are strong. Do you feel the pain? This one you feel the pain. So that's just an example, just to create curiosity. So now coming to the point. No. Usually, see how brain responds is another beautiful thing I'll tell you. Number of receptors are maximum in hand compared to any part of the body. We call it as motor homunculus. motor and sensory homunculus. So this part has changed my mind to study more of alternative medicines. Why? If how the brain sees our body, we are, when we see with our own eyes, it looks like a proportionate body. Head is this much, all. If I see how the brain sees our body, you can open your Google, type motor homunculus. I'm not very good at drawing, don't mind. Motor homunculus, see the image. So this gives me a very different scenario when I do any physiotherapy. If I do, it will give me very different signals. So it means if somebody says hand reflexology, abhyanga means massage and all, it is helping, means there is something which is triggering certain aspects of brain, mainly receptors. When you see that motor homunculus, number of receptors are maximum. There are only two religions, Hinduism and Buddhism uses maximum hand gestures, saying namaste and all those. In Islam they'll use salam, that's one, and Christianity they'll use namaste. In Indian scenario, so they might have already known a spiritual aspect of hand gesture movement. So any therapies we use the hand. Same hand, if I'm mentally, as a therapist, if I'm mentally not very much relaxed, when I do treatment, the patient receives differently. Did you see? If I become more compassionate, more accepting, more relaxed, more comfortable with myself, and then do the touch, it will become touch therapy. Simple touch will become magical. You agree? Something else I wanted to add. So, lot of hand gestures. When this can be proven, this itself is a proof. Where when I teach a mudra yoga, mudras, I'd say that okay, motor homunculus is working. So with this example, with the three more doctors I want to mention, Dr. Mehmet Oz, you can note down. Mehmet Oz, Dr. Herbert Benson, and Dr. Tony Nadir. Have you heard of transcendental meditation? TM, transcendental meditation. Heard of Maharshi Mahesh Yogi? You should know this. So Maharshi Mahesh Yogi is the first. You heard of Sri Sri Ravi Shankar? Have you visited ashram? Did you see Ravi Shankar's Guruji's Guru? Anytime any photo of any Ravi Shankarji's Guruji's Guru? No. Usually it's a very big, it's a very big unexplored business, and spirituality is a very big business. Maharshi Mahesh Yogi of transcendental meditation was the guru of Sri Sri Ravi Shankar, which he never mentions. He learned majority of the things. Sri Sri Ravi Shankar's Guruji, Maharshi Mahesh Yogi, I am not in favor of anybody, but he was the first person who started a lot of yoga and Ayurveda research. First time in the entire world. So, name? Maharshi Mahesh Yogi. So Maharshi Mahesh Yogi finds another doctor who was MBBS, MD, DM, FRCP, whatever, brain coherent studies and all those. That his name is Dr. Tony Nadir. He proposes a research where he says he proves Patanjali Yoga Sutras 194 or 195 sutras correlating with frontal lobe, parietal lobe, occipital lobe, and temporal lobe. And he publishes a paper. Then he correlates Ramayana with brain nuclei. Then he publishes some books. Like Nakshatras and amino acids. See the beauty. Nakshatras and ATGC, in our DNA, ATGC will come, no? The combinations. He proposes that. For that research, he would be awarded around 90 kg gold of his body weight by Maharshi Mahesh Yogi. He was a yoga person, non-medical, non-person. He was a totally medical person. And then this person will become a successor of Maharshi Mahesh Yogi. His name is now Adi Raja Maharaja something. That's just a story that how a medical mind can see the things differently. So when you see things differently compared to anybody else in terms of when I mention Ayush doctors and allopathy doctors, when you see things, you see in a totally different perspective. That perspective you will not be able to explain to the other doctors, but you will be able to implement in for your patients. That will give you a competitive edge. I'll give a little pause, and I want you to process the information and ask me some questions. This is a totally new concept where unexplored, revolutionary, and bit difficult to implement because we go with a common case scenario. Physiotherapist cannot prescribe. Why not? Basic aceclofenac, paracetamol. So there is a rigidity in the system. Do you agree? What a doctor will give maximum? Aceclofenac, paracetamol, serotropeptidase. Correct, no? What doctor do not understand this is writing the prescription is not a treatment, it is symptom management. Functionality, assisted daily living, quality of life. If this little introduction helps you to ask yourself where, how I can be different, then the purpose of class would be served. Give me only 1 minute pause to you think over and ask some questions. 1 minute you can give. Okay, think over.